Hey guys, welcome back to usmleTeam. Today I'm going to discuss briefly about how to approach a patient with arthritis step by step. Very important topic for Usmle examination. Okay, without wasting much time, let me start with this. Come on. Okay. First thing what you need to know is when it was started. When it was started, was it acute or a chronic? Like suddenly yesterday he started having pain in his foot or a toe, then think of gout, crystal induced arthritis, or septic arthritis. Okay, if they give the history of chronic history, then think of osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, and many diseases that are chronic. For acute, you need to differentiate whether it's going to be a crystal induced septic arthritis, okay, pseudogout, gout, okay, infections. Okay, so which joint is involved? The next question, like they give the history of involvement of the knee joint, involvement of vertebral joint, involvement of what you call shoulder joint, right? So what you need to look for before joint, you need to look for whether there is involvement of many joint or a single joint. Okay, like a many joint, if there is involvement of many joints, think of infection like a parvovirus B19, hepatitis B infection, SLE, and rheumatoid arthritis. Okay. On the other hand, if they give the history only one joint is involved, think of osteoarthritis. Osteoarthritis, the most common site is the knee, so you need to remember. Then gout, pseudogout, septic arthritis, trauma, and bleeding from joints like hemarthrosis, right? So you need to know whether it's poly or a mono. That's very important. Okay, the other important point in the which joint involved is migratory. Sometimes they give the history that the pain is keep on migrating, and most of us know what is the most common for the migratory arthritis. That is nothing but a rheumatoid fever, right? Rheumatic fever. So other what you need to know is that can be seen in Lyme's disease, that can be seen in a gonococcal infections. Okay, if that's very important. You need to know. Sometimes oligoarticular asymmetric arthritis is common with ankylosing spondylitis. Okay, and osteoarthritis involving the small joints of the upper extremities, and rarely presentation of polyarticular gout. So this is very important what you need to know. So I told you acute or a chronic, then involvement of the joint, see which joint is involved, see how many joints are involved, poly or a mono, see whether it's a migratory, whether it's oligoarticular asymmetric arthritis, all those things. Okay, so now let's move on to the next important point what you need to look for. Is there any skin involvement or a systemic involvement? Let me see. I don't know whether okay, systemic manifestation is very important. If they give the history of a joint pain and with the skin manifestations, think of SLE. Okay, for SLE, not only the skin manifestations, there are other things, other many things that you can see. A patient, they can have a proteinuria, renal failure, vasculitis, strokes, changes in the personality, rashes, then anemia, thrombocytopenia, pleural effusions. There are multiple involvement seen in the patients with SLE. So to diagnose a patient on the basis of arthritis is very easy if they give the history of other systemic manifestations. Okay, sometimes they can give only the Raynaud's phenomena or skin involvement, then think of sclerosis, systemic sclerosis. Okay, if they give the history of joint pain with sinusitis, rhinitis, respiratory tract infection, or glomerulonephritis, then think of vaginous granulomatosis. That's very important. This is how that this is what exactly the things you should know. Okay, so the other thing what I want to tell you is skin rash, as I described you earlier. Even if you think of psoriatic arthritis, see there is the history of psoriasis in the patient. Actually, they give the patient is having psoriasis and he is taking treatment for that and he's doing well, but after a few months he came back with the pain in the joint, so blah 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 blah. First think of psoriatic arthritis before jumping to the other diagnosis. Okay, because when the patient has a psoriatic arthritis, definitely psoriasis, definitely he will develop psoriatic arthritis, right? But there can be a possibility of other arthritis too, right? So definitely I will put video on psoriatic arthritis and different kinds of arthritis. If you have any topic you want me to discuss, please let me know so that I can do it for you. Okay, there are some joints what you need to look for, like a cervical bone, DIP, okay, PIP, MIP, okay. So cervical bone, this cervical bone involvement and DIP. The DIP bone is never involved in rheumatoid arthritis. That's very important, you need to know. Okay, the cervical bone involvement can be there, but it's very rare in a rheumatoid arthritis. So there are few joints that you should know. Sometimes vertebral bones involvement is very important, because osteoarthritis, if they give you vertebral bone pain and you are thinking of osteoarthritis, they can be, but don't think of osteoarthritis in that. They can be, I'm telling you, there's not, they can be, but think of the other options rather than the osteoarthritis. Okay, that's very important. Okay, thank you so much for watching my video. Let me see if there is anything. Okay, thank you so much for watching my video. Please let me know how I am doing. If you have any questions, please comment, please thumb up. Definitely I will try to improve myself. If I made any mistakes, please apologize me and let me know, so that I can improve and do more and more videos for you. Thank you so much. Please do subscribe to my channel.